News and information from Georgia State experts about the current global health crisis. This is 88 Affairs, a program for our Georgia State University community and WRAS listeners. I'm your host, Andreas Preuss. Joining me for a conversation about public health during this pandemic is Shanta Dube. She's an associate professor in the Department of Population Health Sciences at the GSU School of Public Health. Dube joined Georgia State in 2014 after a 14-year career at the Centers for Disease Control. Shanta Dube, thanks for joining me.
Thanks for having me.
At this time, we're looking at fall 2020. In August, many school districts are starting up, at least in Georgia, and you've got a lot of adults making decisions now about whether to do online classes or in-person classes. What do you think the children think?
The children are beginning to realize just what kind of situation we're in. And the sense I'm getting, especially in talking with parents and, some of their kids, is they understand, these kids, as young as they are, understand the gravity of the situation and really want to be safe for themselves and safe for their peers. However, I do think that there are a significant number of kids, at least the ones that I've talked to, that are concerned about their peers being able to interact with their peers. How are they going to learn online? And from the parental perspective, I think what we are understanding and learning is that there's a lot of concern from their perspective about the safety of kids if they go back to in-person learning. But yet on the same front, there's also concern from parents in terms of how will I work while I'm trying to get my kids learning online at home. There's just a lot of mixed emotion around this right now, a lot of unknowns and confusions, to be quite honest.
Do you think it's feasible for children in this current environment of positive test results, things are back on the upswing, that it's feasible for students to go back to school that could be pulled off?
To be quite honest, I really don't know how feasible it is, especially for the younger kids. How is one going to control younger kids to not go up to Johnny and touch Johnny, or to really understand the need to be distanced or to wear a mask continually? I do think across developmental periods there will be variations in terms of understanding and ability to adhere. But as I think about it, and as I've been contemplating and pondering, it just doesn't seem completely feasible to go fully in person and start school in the standard practice as we know it, which is in person. There's also the issue around the teachers and their well-being, and there's a high proportion of teachers that they themselves have chronic disorders, which put them at high risk. Then you have older teachers. All in all, as a public health scientist, I am not in favor of a full-on, let's just reopen the schools in person. There has to be a very systematic, concentrated plan. For instance, staggered learning or going completely online. Now, if schools go completely online, the other aspect to consider is making sure that all families have the needed connectivity for the students and the parents to access the online learning materials. And right now, there's not educational equity across the U.S. So that's another barrier that we're going to really have to think about. From the perspective of infectious disease epi and understanding the transmission, it really just doesn't make sense right now to go full-blown to opening up schools.
Do you think that government should be making the decision or parents should be making decisions?
I actually believe that parents' voices need to be heard in terms of what are the key barriers to going fully online. But I do think to some degree the governments need to lay out a plan that's going to be feasible for local educational agencies and parents to carry out. What that plan looks like, but I do think it has to be a collaborative effort. I do think that if government and we have some kind of silver bullet without really thinking about the needs and concerns of parents is not going to work. Because on one end, parents don't want to send their children back at all. They don't want to have them in a potential environment where they could get sick or even carry it asymptomatically and bring it back home. You have teachers who also don't feel comfortable going back to the classroom. Then on the other hand, you have some parents saying kids do need to go back. We got to figure out a way because I don't know how I'm going to work from home and facilitate my child's learning at the same time. It's very complex, but I don't think just the single answer of saying, okay, we're just going to open schools back up and we're just going to be business as usual is the correct and optimal way to move.
What I think you're saying is that you do believe there should be a collaborative effort.
Yes.
Between government, school districts, and parents because of something you do mention, which is the digital divide, which is some do not have access to the internet, or at least strong internet, and you've got a lot of rural communities that are just not wired like inner city school districts are. So that is a valid concern, this digital divide.
It's a major concern. And it really does need to be addressed. So I'll give you an example. I happened to speak with a teacher from Texas a couple of weeks ago, and it was brought to my attention that in that district, that they actually made sure that they had the resource because they were going fully online in fall 2020. And so that district made sure that they had the budget and the resources to provide the families of students in that district with hotspots in the home. Apparently, it's being used right now in the summer school classes, and it's been received very positively. You know, my question to her is, are they even using them? And the answer was emphatically yes. And they're really happy to have them because otherwise they would not have been able to get, learning jump started for the kids. I know that there are some efforts around providing mobile Wi-Fi. So getting creative at this point to ensure that all families, if we're going online, especially with this digital divide, that all families have access to some form of connectivity is going to be key. And frankly speaking, we are very technologically advanced. We should be able to do this. We should be able to find the resources to offer this up, mostly to those families who don't have connectivity.
What we should do and what we will do are usually two different stories. You did hear when the University System of Georgia went all online at the end of March that there were students that were in rural communities that would have to go to a Starbucks or a McDonald's just to fulfill their assignments. Being equal and fair in assessing online education is a very important factor, especially with the digital divide that can affect certain socioeconomic groups that we may not always be thinking about if you're living in the city and you've got totally wired community. Well, there's a lot of people in Georgia, in rural Georgia, that don't have that type of access.
Right. So I want to just point out one of the things I've worked on for decades, even during my time at CDC, was not just this idea of social determinants of health and health equities, but at one point I was working closely with some colleagues around the educational inequities in the United States. So if we talk about education being a social determinant of health, and there are so many divides in terms of equity across school districts, that is a big problem. Because basically what that's saying is the one factor that can lead to positive health, which is education, is not evenly distributed in terms of resources and funding across the United States. That's a big issue. And, I think that, frankly, COVID-19 is surfacing for us so many things that have been lying undisturbed, hidden for so long, and things are starting to bubble up and surface and raise attention and awareness. And one of those is, frankly, something as simple as digital divide, where we're now having to utilize social distancing as a non-pharmaceutical intervention to prevent transmission of COVID. And in doing that, making sure that we keep kids at home learning online, if that's what certain states and districts are doing, but then learning that they don't even have the means by which to learn online. What else don't they have the means to learn by, even if they are learning in person? What other means are not there? There's a lot of educational disparities in our country.
Yes, and you make a good point about the COVID exposing things in the shadows, things that have been lingering there, and especially with public health and education, these are all things that are now coming to light in a pandemic that is fatal for some people. And in Georgia, you see numbers rising. You see positive test results rising. You see the whole trend going upwards where, it had been going down.
Yes.
And now in the summer it's up, and then it could go back up in the winter, which was predicted, because the virus was going to take some mysterious break in the summer and go to the southern hemisphere and wreak havoc down there. But because states reopened and people were getting back to their normal life, maybe the exposure was just a little bit more.
Oh, for sure. And I think all of us in the public health epidemiology community have been saying it for months since this started, that we really need to heed the science and the data and really get this communicated and messaged properly to the public at large. And I think that I as a scientist and somebody who's extremely passionate about population health, I'm perplexed at where we are today, to be honest. I got into epidemiology because when I was 12, I think, I saw some news clip about a salmonella outbreak and how epidemiologists linked it back to cantaloupe. And I thought, God, this is a fascinating science. If I could do, this is what I want to do. I want to understand outbreaks. I want to understand disease patterns and help others. And it's very difficult to kind of see how things are playing out when we are a very adept and skilled discipline and we know the science. And sadly, we're seeing it play out in a completely opposite direction that it really doesn't need to be going. It could be going in a very positive direction, but for whatever reason, many reasons, we're not seeing that.
I'm speaking with Shanta Dube. She's an associate professor in the Department of Population Health Sciences at the GSU School of Public Health. And Professor Dube, I know you don't speak for Georgia State or the School of Public Health, but what you just touched upon is a fascinating, maybe even unfortunate situation that we're in with the mask wearing and return to classroom becoming political issues, whether you're on the left or the right, or you want to wear a mask, or you don't want to wear a mask, or you want to go to school, or you want to do online. Have you ever seen something like this in public health, that these kind of supposedly simple things like wearing a device, a mask, to help stop the spread of a virus have become political issues?
Wearing seatbelts, smoking in public, we have met with these challenges many times in the past. However, I will say, with those two examples I just cited, we weren't dealing with a highly transmissible infectious agent. And so the time it took to change attitudes and norming, let's say, around smoking and exposing non-smokers to secondhand smoke, which we know is extremely detrimental to health, might have taken a little longer. But, what we're seeing with the mask wearing is not unfamiliar. I think what it is it's surprising from the perspective of, if we know we have a highly transmissible disease, and one of the clear ways to protect ourselves and others is wearing a mask, why aren't we doing it? A couple of things around that is, first of all, our country, from a cultural norm perspective, we don't wear masks here. Even if the pollution, Atlanta pollution gets really bad in the summer. Maybe not so much this summer because people aren't driving as much because they're working from home. But in previous summers, since my 20 years of being here, we've had some pretty bad days where the pollution was very thick. But you don't see people wearing masks normally in that situation. You don't see people wearing masks when the pollen count is really high. It's not something that's a normative behavior in our country as it is in, say, some other countries, such as in Asia, where you do see people wearing masks when there's high pollution or allergens or irritants. So that's one thing. We're not used to it. The other thing we're not used to is many times being told what to do. I mean, we like to be able to make our own choices on things. That's what our country is, if you will, built upon. And so not wanting to be told what to do is another aspect around this. And so allowing people to have their freedom to decide how they're going to protect themselves. But I think another issue around this is, and I don't know how this is going to come across, but I'm going to say it because it's based on, much of my studies I've done between cross-cultural comparisons between the U.S. and other countries is, we're kind of an individualistic society here. We're not group-centered. And basically what I mean by that is countries in Asia are very group-centered. And so when I've talked to either my relatives or friends from other countries, the idea of wearing a mask is not just for themselves. It's to understand that it's going to have an impact and protect others, more of the collective, if you will. So it's not that, yes, this is an inconvenience for me. I'm not able to really make this choice. That attitude doesn't come in. The attitude that comes in is, gosh, if I don't wear this mask, not only will I hurt myself, but I have the potential to hurt a lot more people around me.
Your mentioning of these factors, especially the cultural concerns, and as well as there was a lot of mixed information about mask wearing.
For sure.
Wear a mask, don't wear a mask, the Surgeon General, Dr. Fauci, and now with everybody, especially people in your profession, the public health, wear a mask. Wear a mask. We got to wear a mask. So there, people get confused and back and forth. And as well as I think the educational aspect of fall 2020, we want to go back to school. We're going to go online. In Gwinnett County, which is one of the hardest hit counties in Georgia, they said we would be going back to class and parents could make a choice whether they wanted to do online or go back to class. And then Gwinnett said we're going all online. And the choice was taken away from parents because of issues you've discussed that you just can't, at least in the current situation with the COVID, control the safety and welfare of students and teachers.
We've been talking about schools and parents. Gwinnett County is going fully online. Have we talked about employers and businesses and how they are going to work with parents of young children to ensure that they have the flexibility, that they have, we know businesses have the remote capability because most adults, not all, I know several of my neighbors who've gone back to physically being in the office using social distancing, as have, some of the campuses around Georgia. In general, I think some thought needs to be given to and some serious consideration needs to be taken by businesses to ensure, as, say, like a county like Gwinnett going fully online in the fall, that parents are given what they need from that aspect to be able to fulfill their duties of their jobs as well as fulfill their duties as parents and, work with their kids through the online learning. And that's one thing that I often think about.
And once again, collaboration is a key word because, as you had mentioned, collaboration between government and parents can help solve, not solve, but help solve or come up with ideas. Now you're bringing business into the mix with education.
Well, employers. It could be a business, it could be whomever the employer is, but let's get that into the mix here so that the parents aren't left feeling unsupported. I'm thinking, I've talked to my friends. My daughter's graduated, college, but I'm thinking back, like, what would have happened if I was having to make sure she was doing her online work and learning? But I think about families and parents, one, single parents, two, parents that work very odd hours, maybe don't have all the skill sets needed to do online learning with their kids. I think about that a lot because, as I said previously, there's a lot of inequities in our country.
Mm-hmm.
And so when we think of inequities, it's not just the resources, the monetary material resources. Inequities materialize in so many different ways. And one way is, we don't all have the same knowledge base or skill sets. Does that make sense?
Yeah, I think at the end of the day, it's all about collaboration, and whether it's business, government, parents, and the children. Are they involved in these discussions? They should be, at least as they get older, and I'm not talking about a first grader or a second grader, but middle school, these high school, they should be having these discussions. And of course, we're at Georgia State, where you've got, undergrads, grad students coming back to whatever the campus will look like in the fall, getting that kind of back and forth from the public as a public health official, you would embrace that.
Right. And let me just say a couple of more quick things. You made a point about the confusions around mask wearing early on. I understand that was such mixed messaging, but I also want us to understand that we're not dealing with the flu virus, which we've studied for decades. We're dealing with a novel virus. Unfortunately, or however you want to look at it, we've had to learn as we're moving along. I'm not trying to blame and shame or actually dodge responsibility. It was unfortunate that was the mixed messaging that happened early on, but we really didn't know much about the virus. Nothing was really known. We still don't know a lot about the virus. We still don't know how long-term immunity is going to look. We don't know any of this as yet. I think we're getting closer. I think we have some outstanding researchers on the ground doing some fabulous work for us to better understand, but we're still in a very steep learning curve.
Yeah, it's a mystery, this virus and its developments, and then you've got the issue with the antibodies. Is that a viable situation? If you get it, you will never get it again. That's not a proven thing. You've got the possibility of a vaccine. There will be a vaccine. When's that coming out? I mean, when is the world going to get back to normal? Things seem very confusing and very crazy because it is a wild time right now. What could you tell the listener involving our current situation? What can we do to stay positive? Because there's a lot of just negative issues right now.
I think the way to try to stay positive through this is, I don't know if this is going to make much sense, but just trying to have a moment of contemplation, just contemplating what's happening in our world right now, and really try to, I don't know if this is going to make sense, but almost like take ourselves out of it and be observers of what's happening. Also, when and if possible, to really understand the positives that have come out of this for us. I'm not saying everybody's had a positive. I mean, people have lost close dear ones, and it's been tragic on so many levels. But if we could just find one good, that potentially just one, even a quarter of a good that's come out of this, and try to reflect on that. And I guess the other thing is to really kind of, if you will, I'll tell you personally, for me, I have really reflected on the magnitude of the impact this has had on so many people. And I've tried to help others where I can as we live out this pandemic, more on a personal front. And I think we just need to really capitalize on our assets and strengths and find ways to come together and help one another. And I know we can do that because our country's been through so much, and I've seen it happen before with so many different events. If we could kind of keep that light on it and work towards that, I don't know, I think we can overcome.
And as you've said, we're learning new things, we're developing new strategies, new policies,
Right.
making decisions that we've never potentially thought we would make. I'm talking about the general public. Public health professionals like yourself, these are the worlds that you live in. But for the average citizen, these are strange times. But
Yeah.
as
Yeah.
I always say, humans are resilient. We will get through this and see what's on the other side.
Absolutely. And I guess the only other thing I would say is just being mindful and really watching ourselves and taking good care of ourselves, our mental, emotional, and physical health and well-being, and being mindful of others who might be feeling the stress and pressure from all that's happening. Because you know what, frankly, everybody responds to stress differently, and we just need to be aware of that and understanding and empathetic towards that. I know I have to. I find myself trying to make sure I'm careful and heed other people's responses, etc., to stressful things, especially in my household. So I think that's another really important aspect. Maybe we will get better at taking care of ourselves in some respect and taking care of others.
Shanta Dube, thanks for joining me.
Thank you so much for having me. It's been a pleasure.